It is,
But wait till, wait.
oh,
I brought the file. Mumford Street.
I didn't get back to, oh, look at me writing this. Okay, Bob.
okay.
We're good.
It is Wednesday, March 3rd.
18th.
Oh, I'm sorry, March 18th, my mistake. March 18th, 2020, and I'd like to call the Board of Health meeting to order here. For everyone's information, this meeting is being broadcast live, only allowing 10 people in the meeting at a time. Town nurse or speakerphone, town nurse on speakerphone for questions. So we'll begin the meeting addressing town nurse increase hours.
And people can call in
Okay, people can call in as well.
on that number.
The number is 508-476-4000, extension 222. Well, let's, so town nurse hours to increase.
Yeah, I think we need to make a motion that we increase or allow the town nurse to increase her hours as needed, as long as the situation lasts.
I'll second that.
Okay, all in favor?
Aye.
Aye.
Okay, the motion is passed. We also have next on Board of Health office, temporary operational hours.
So wait, is the public allowed in the building?
So the public is not allowed in the building as of tomorrow.
Okay.
And the Board of Selectmen met last night, and it's going to be by appointment only.
Okay,
That's what
So
they
if anybody has any town hall business at all, it'll be, they have to call the department to which they're conducting the business, set up an appointment with the secretary, come in, do their business, and leave. It'll be that sort of quick exchange.
Does that mean the doors are locked?
Yes, yep.
Doors will be locked. Those departments will have to let the person in by appointment. Let that person in, do their business, and then that'll be how it goes forward. And that'll probably be at the department's discretion. And we can make another arrangement if things progress.
Yeah, there's a drop box out front. People can drop things off. We can pick it up.
Right, so if there's
Or
any
mail.
business to be done, it's suggested that any residents that need business done, they contact the secretary of the department where they need the business, and they'll get instructions from the secretary. Either she'll have them, or he'll have them put something in the Dropbox.
Email.
Email can work, but we're limiting face-to-face contact, where I think we're taking this pretty seriously, and we are exercising the social distancing recommendations, as well as no more than 10 people in an area at once, that recommendation too, which is why we've prompted, I think, to close the town hall and to have that appointment only.
So what will Kristen's hours be?
That we're all working the same
The
hours.
same hours, just need an appointment to talk to you,
Yep.
unless they talk to you by phone.
Talk to me by phone, email, drop something in the box. I can pick it up.
Right. Email.
There shouldn't be a
phone
lot
call,
of face-to-face.
and in the box. We're just limiting the face-to-face contact and the amount of people that are coming through the town hall on a daily basis.
Right.
if I can just step back for a minute, I did miss something here, authority to delegate responsibility, and exactly, Kristen, can you help me on that? What does that mean exactly?
So if it gets really crazy busy and there has to be a lot of phone calls or
Okay.
anything, we can take employees from the town to come in and make calls or whatever she needs us to do.
Okay, so she can delegate that.
Yep.
So if or when this pandemic climbs or gets worse, and if we start to have any positives show up in Douglas, then the nurse may get inundated with too many phone calls, because you have to start calling all the people that that person's been in contact with. And if that number starts to grow, that could quickly get out of the scope of something that she could do on her own, or even that her and Kristen can do, even with less people coming into the building. Like the other day when we were here trying to talk to you, it was here for a good hour, and we probably only had 10, 15 minutes of conversation just because of the constant influx of people conducting business. So if that number can subside a little bit, that'll free up some time for you. But still, the nurse may be inundated with so many phone calls in the next 2 weeks from now that I think it's going to be important that she's able to have people help her do those kind of things.
So she has the authority to delegate that.
We probably need to make a motion.
And Matt's already,
Where does that come from?
Matt, it's.
Oh, okay, okay,
We have the authority to do that.
okay.
So we probably need to make a motion to allow additional staff be made available for the specific duties related to COVID-19 and its monitoring, and allow the nurse to make such decisions.
Okay, so that was your motion.
I'll second
Okay,
that.
okay. Motion's been seconded. All in favor?
Aye.
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 Okay, the motion's passed. Let's move on to the next thing on the agenda here. Board of Health Office, temporary operational hours. What does that mean to you, Kristen?
Just that we're going to do the appointment only, and
Okay, okay.
we're all working the same hours that we
Oh,
were
but
working.
you're still, yeah, okay,
Still here the same hours.
okay.
So it's more just
Did I
Just know-
reiterating that people have to call ahead. They can't just show
Just
up.
trying to
Right,
keep
right,
distance from
The
people.
doors are locked.
The doors are locked, but business still goes on.
Okay,
We're still here, phone calls, emails.
So phone calls, emails, Dropbox,
Yeah.
really by appointment. People need to really.
If need be,
Right,
yeah.
right. Take the social distancing thing pretty seriously, and
okay. Moving ahead, I guess. The next on the agenda would be the transfer station safety precautions. Now, as you know, we just received a call from George up at the transfer station. He's concerned about the plastics and the cardboard because they're, trying to push that, the plastics back into the containers, and the wind's blowing in their face. They're in contact with the plastics. They're in contact with the cardboard because people do not, I shouldn't say people in general. I say some people do not break down the cardboard as they should. So, our people up there are trying to do the best they can to push the cardboard into containers. And he's concerned about, basically, about coming in contact. And I understand that.
We gave them a box of gloves,
Yeah.
and they can have masks.
But like he says, yeah, you can do that.
Yeah.
My suggestion was, only a suggestion, was that possibly we could, for the time being, put everything in the compactors. Just compact everything, and then it'll reduce the shipments, the hauling. Right, and we'll, if we do get overloaded for some reason, then we can use the other option to just put the stuff in the open containers or empty containers. But I think for the time being, he felt pretty comfortable about that, so.
Couldn't we also not try to fill the cardboard and plastic containers?
Yes, but like he said, the wind gets in there and the plastic blows right in their face, you know what I'm saying? So that makes it difficult for them. I can certainly understand that,
Plastic's so light and blows
Right.
around in there. We get a good wind.
Yeah, I could,
Temporarily close recycling, all recycling, or just the plastics? And
well, the plastics and cardboard, yeah, all the well, bottles, I suppose, can stay the same, but maybe we should just look at everything, just compact everything right now,
Affecting everything.
yeah. I mean, it's less risk for things to fly around, obviously, and,
Yeah,
Right.
it makes sense.
I think so too.
Huh?
I agree, I think it makes sense.
Yeah, yeah. Okay, so,
This
we get
is,
'em.
this sounds like a short-term solution, but I don't believe it will be.
no,
I think we're talking not weeks, but months.
I realize that, yeah.
Okay.
Yeah, but I mean, what other option do we have?
No, I agree.
If you have an idea, we certainly want to hear it.
Right.
As long as, because this will have a negative impact on the budget also.
Yes and no, because,
And no.
Well-
recycling.
yeah, I mean, less transportation fees, because you're compacting everything,
Okay.
you know? I mean, we have to look, yes, we have to look at the budget, but we have to look at safety too.
Oh, safety's first.
Right.
Safety
And
first.
the cardboard, I mean, wouldn't it be nice if everybody could just break down their cardboard boxes and throw them away, like?
Well, it would be
The
nice.
guys
but-
don't have to go in there and
Right,
do
it would be nice, but you know as well as I do, that doesn't happen.
Right, there's gonna be, I
Right.
mean, 3 or 4 people don't do it.
And to be quite honest, if I were working up there, I'd be concerned,
And I would just want to pack,
sure.
yeah.
Just get it, you know, they don't have to deal with it,
Right,
and that's it.
and the less
Right.
contact with that material, because that stuff is in people's houses, so.
Right,
The
right,
less contact with that would be better.
right, God only knows
Okay.
where it was, you know.
Right. All right, so I would say,
So is George going to take care of the signage, George and Dick, or,
We haven't spoken about signage at all.
well, you have to do something because they're going to put it,
Well, we closed the bins, and
right, we'll put a sign up.
we should have a sign up, but yeah, we,
Once we close the bins that say, you know.
that is a
everything's
good
gonna go-
point. Yeah, we should have signage coming in, so they'll know right away.
All right, and then
Is there
there's a
anything
sink
else
there.
in that?
There is a sink at the transfer station, so they
Yes,
can, and we
there's a
have
sink, yeah.
plenty of soap, they can wash their hands regularly.
Yeah,
Because they'll still be selling
Sanitizers?
stickers.
Sanitizers?
I think soap is always better than hand sanitizer.
Yeah, probably, but you know, just quickly, sometimes, you know, instead of going in, washing, or, you
We
know.
have some PPE up there too, like rubber gloves or.
I gave him a
masks.
box of rubber gloves, yeah.
All right, do we have any 3M masks, like?
I have not that kind. We have,
Some medical masks?
oh,
Okay, good.
that's not, those are gloves. No, the mask.
But they
Yeah.
can get,
Does anybody want a mask?
all right.
I shouldn't make fun of it because it's,
But they-
I'm thinking about it all the time myself, you know,
Yeah.
constantly, oh gee,
Yeah.
I should have a mask on,
Oh, yeah.
but,
All right, so we can provide the transfer station employees with masks and gloves, PPE, and they can wash their hands regularly. The only contact they should be having with residents then will be to sell a sticker.
Well,
no.
yeah, we're talking about
No,
that.
we're not going that route.
We're
Or
not.
you're gonna do mail-in, right?
We'll do mail
Mail-in.
only.
Mail.
Mail in.
sticker.
And
That
if
makes
people
sense,
come up and they
yeah.
don't have a sticker, you're going to let them dump anyway because, you know, you just inform them that they're going to have to do everything by mail
But they can drop it in the Dropbox
and
too.
drop in the Dropbox, okay,
And we'll mail.
And
a
I'll
sticker
mail
back
it to them. So it has to be a self-addressed stamped envelope with it.
right.
All right,
So a
so,
check, a self-addressed stamped envelope, and a picture of the license if it's over 65, and a copy of the registration. And I'll mail everything back.
all right.
Okay. Yeah, I'll make a note on that.
Yep, copy of the registration.
Copy of license,
license,
if over 65.
if over 65.
Self-addressed stamped envelope,
Self-addressed stamped envelope
and a check made out to Town of Douglas.
and a check. To the town office. All right, and that's for transfer station sticker renewal. Most of the stickers have been done by now.
What am I missing here? I have copy of registration check, picture of license,
Registration.
registration.
Yeah,
And self-addressed
Okay.
envelope.
self-addressed stamped envelope.
Oh, yeah, stamped envelope. All right. So there's the sticker requirements, safety precautions. So there should be no real face-to-face contact with
No.
transfer station employees then?
No,
should just
they
be-
want to drop in the Dropbox out front, they can do that, just put it in an envelope marked Board of Health.
Right, checking. I mean, they should still be checking, making sure people have stickers, but as people drive by, I think the speed limit's there. They go slow enough by the booth there. They'll be able to see that. And they can see the packer to add more things in there, to pack it when they need to. So there should really be minimal employees walking around at this point.
Yeah, stickers were due March 1st, right?
Yeah.
Which I think is what Kristen was
Right.
alluding to, that pretty much this should be done.
Right.
There's still a lot of stragglers, but
Supposed to, but there are still
a
a
lot.
lot of people
Oh.
coming in.
Yeah.
In fact, I was there yesterday, and I was there for only like 15 minutes, and in that span of time, there were probably about a half dozen
Yeah.
people that came in
Wow.
with stickers.
Well, I think there's unfortunately quite a few people that aren't really taking this spatial, this
Yeah.
social distancing thing.
Right.
as
And to be quite
seriously as
honest
we
with
should.
you, I don't think I was taking it that serious myself until, it seems like as the days go on, it does get more and more serious. And I think it's legit. I really do, so,
Oh, yeah, I think we need to take it seriously.
yeah, yeah,
And the public needs to take it seriously.
absolutely, yeah.
Is there a Dropbox at the transfer station also?
No,
Just
Okay.
out front here.
Okay.
yeah, yeah. So that, yeah, the question there was, for them, from them, was that they didn't know if they should just let the vehicles come through. And certainly, we want the town people to dispose of their trash properly, not in my yard.
Right.
Because usually, that's where it ends up.
Right. So, so the transfer station will remain open, minimal contact with transfer employees, stickers, like we said. You would have to mail, put it in the Dropbox with all the information that we said, the copy of registration, the copy of license, self-addressed stamp envelope, and a check made out to the town of Douglas. Transfer station employees have wash station, they'll have PPE, they'll have gloves, they'll
Right, right,
have masks if they need them.
right.
Does that cover us for the transfer?
I think so, yeah,
So
I
so
think
we're
so.
closing the recycle bins. Everything will be compacted for the time being until further notice,
Yeah.
or at least the plastics and cardboard. Are we still going to leave
I
the
would say,
bottles or just pack everything?
pack everything.
Pack everything for
Bottles
now?
included, yeah.
All right, and then we can readjust on the fly if we start being inundated with trash or
Right,
something.
right,
I mean, we always have a 40-yarder too, so
right, right,
the open top 40-yarder, we could fill that too if we had to.
right.
It strikes me that Saturday is going to fill the compacting quickly.
Well, if it does, I mean, we have to try it anyway, see how it works. If it does, it does. And like Corey said, we'll use the open containers to dispose of whatever we have to, but let's give it a shot and see what happens,
Yeah, I don't really think we have a better option.
No, I don't.
I mean, if
But
we
we're
had
going
a
to have to
packer
make
already-
sure that, they're going to have to pick up before the weekends.
Oh, yeah.
What about paper?
What's that?
Paper goes in there as well.
Everything is, so there is no recycling.
No,
Recycling's done.
well, it's
For the
not that
short-
it's.
For the
not-
short term,
For the short term, for
which
time
may
being.
be a couple of months.
Possibly, could be more than a couple months, I don't know.
Okay.
Nobody knows right now.
Right, hopefully not.
But
I mean,
This is uncharted
Territory.
No doubt about
territory,
that.
and, yeah, so we're just,
so,
so I just feel that if we compact everything, then there is no question, that's it.
right,
That's it,
right.
that's it.
Yeah, it's not what gets compacted, what doesn't, what can I recycle, what can't I?
Right.
We just closed the recycling portion,
Right.
unfortunately, for
Right,
hopefully what is just a short amount of time. Hopefully
Right.
it doesn't last more than a couple of months.
Right.
And things will be back to normal
Right.
sooner than later. But like I said, right, this is uncharted territory. We've never seen this
No,
before. This is
no.
a
So this-
first. And
yeah,
we
this-
want to be with an abundance of caution, approaching everything with an abundance of caution.
absolutely, yeah,
So
Keep
this is-
everybody as safe and healthy as possible.
right,
This is what we're going to do until we decide to go back to recycling.
right,
So until
right.
we
have,
sit and make a decision,
right,
no recycling.
right. We have every intention of going back,
I understand,
but,
yeah. I just wanted to clear that we will have to make the decision to go back.
Yeah.
Yes, yes, yeah. Okay,
Yep. All right.
all right. So moving ahead, we have discussed recommendations for Board of Selectmen to close Town Hall to the public.
That's all set now.
It's all set?
Yeah.
So what is
We
the,
had made
what
the
is the?
recommendation the other day, and then they, last night at the Board of Selectmen meeting, I think they approved to put the town of Douglas in, are they? Are we
Yes,
going to be in a state?
Starting
tomorrow, yep,
As of tomorrow, we'll be in a state of emergency, and the town hall will remain closed,
to the public.
like we said, to the public, essential employees only, and then, and by appointment. I'll limit the amount of foot traffic,
Yep, yep,
practice social distancing, and no more than 10 people in a given area at a time. Take those recommendations seriously from the CDC and
right.
Department of Public Health.
Now, we're getting near the end. Should we re-advertise that we're taking telephone calls with a number?
Oh, yeah, well, yeah,
You want to read that off again, the number? in case
Sure,
anybody
I will read off the number, good idea. So if anybody, any Douglas citizen has any questions concerning the COVID-19 updates or anything else that you may have a concern about, you can contact, you can be part of this meeting by simply dialing 508-476-4000, extension 222.
Right, the town nurse is on speakerphone still, if anybody does have questions, or if any of the board members have questions for you. Agnieszka, do you have anything that you want to add so far?
No, just think
Any updates?
covering all the aspects. So far, I can only add that so far we have no presumptive or positive or confirmed cases of COVID-19 in Douglas, and we have no one on quarantine right now that required quarantine.
Yeah.
We are working around residents who are under self-quarantine and voluntary, and this is mostly related to the travel, but to the no high-risk areas. So
Yes.
those people are not required, but they choose to quarantine, just proceed. But so far, we are preparing for it. I'm using this time to educate myself, to learn more, to understand the requirements and policies, and hopefully we'll be ready when we have to be.
Excellent.
Okay. Anishka, have you heard from anybody outside of the town? Are you networking with other towns?
Yes.
You are?
I mostly work with the Board of Health in Uxbridge,
Okay.
and they are being very helpful. There is a nurse who is having several people under quarantine right now in Uxbridge, Northbridge, surrounding towns, and so she's a great source of information for me, and she's already doing it, so she has experience, and I have all the contact informations to them, so we are working very closely as a team.
Have there been any people that have contracted the COVID virus in this area, in other towns, surrounding towns?
Not as, what I heard of was only one case confirmed in Charlton,
Okay.
but nothing in this area. But those cases in Uxbridge, Northbridge area, those towns, this is just people on quarantine. So which means they were not tested, they are not presumptive positive, they were not tested positive. They only had a contact or had a with someone who, most of them is ready to travel to the high-risk areas. So maybe they went to Europe, those countries which are on the list, high-risk areas. But there is no presumptive positive cases. It was not, as far as I know, a couple of days ago.
And I think Worcester County as a whole is only, or as of this morning, was only up to 8 cases,
Yes.
I think, in Worcester County as a whole, so
But
right now the numbers are low.
Yeah, I know one is in Charlton, but nothing closer to us as of today.
Excellent.
Right, and if I think the social distancing thing, if people continue to take that seriously and limit the amount of business and travel, we'll keep that curve really low. Because I think the problem is that if that curve goes too high, right, if too many people get this at once, the hospitals can't handle the influx.
Exactly.
So the idea is to spread this out so that the hospitals can handle the amount of people that really need to go to the hospital over this, especially our elderly.
Definitely. This is, those recommendations are put in place for a reason, because they work. This is what will help us to reduce the number of infection.
I also think that, in any case, if any person has any doubt about whether or not they should be checked for the virus or simply checked for any kind of symptoms of the virus, that they should do that. They shouldn't prolong it, they should do it immediately, because this is very serious.
No, I heard that some hospitals are doing sort of like an outpost, so that they don't have people actually going into the hospital just to get tested or checked. Do we have a hospital that's near us that's doing that sort of a thing, like setting up a tent out in a parking lot where you can drive up and be swabbed?
The recommendation is still the best is to call the primary care physician.
Okay.
Discuss this with them. They usually have a list of the places. We don't know if they already have their tests. Some may have.
Right.
The best thing is never show up at the doctor's office and tell them, oh, I think I have an
Right.
infection. Always call and they should give you direction. If you face any problems and you don't get the help from your primary, then please contact us. So we will help you to find we'll help you to, we'll direct you where to go and what to do next.
Right.
But primary care is the first place you should call and get the information from them.
Okay. So the protocol would be to contact who first, Ignatia?
The primary care, your doctor.
Okay, primary care, and then from there, if it's very difficult sometimes to contact the primary care physician, especially in times like this, what are the other options?
This is seen in the doctor's office. They may want to see you, they may send you to ER.
Okay.
But in order to be tested for COVID-19, you have to meet certain criteria.
Okay.
Just to, if you go and just tell them I have a fever and I don't feel well, doesn't mean you're going to be tested. And I know of cases when someone was not feeling good, went to see primary, the next day was sent to ER. It was like flu-like symptoms, and at the ER, that person wasn't tested for COVID because, according to emergency doctor, that person didn't meet the criteria for COVID-19. So it has to be some indication, like travel or contact with someone who could be infected, could need to be some criteria met before.
Right.
And this is very fluid, right? This is evolving day to day too, so things are changing.
And maybe when more tests will become available, they will be testing more widely. But
Yeah.
right now, they have to really test those who need it.
Right. So as of right now, there's limiting testing, but this is very fluid, so as things progress, it's expected that certain things will probably increase. Maybe like one of those outposts will become more available in Worcester County or something as the need arises, I would assume.
Ignatia,
Yes?
how do you feel about urgent care? What's your thought on that?
You know what? Urgent care, I would also call. Like before you go, at night when your doctor's office is closed, you cannot call your primary, but never show up not calling ahead. They have
Okay.
to be prepared for you to coming. They should know you are coming. So that's another option. But always call and see what they're gonna direct you to do. Because the weekends and at night, that would be the place to go, probably. The best option,
Right.
ER, but always call and see
Sure.
if they will be willing to see you, because they may not be prepared, or they will recommend you to go somewhere else. But they have to know that you are coming with flu-like symptoms.
Excellent.
Okay. That's great advice, Ignatia.
Thank you very much.
Thank you.
You're welcome.
Anything on that? Anybody have any input on that?
No, I think that was well said. I mean, call ahead, call your primary, call
Right.
urgent care ahead, make sure people know you're coming, know your symptoms ahead of time, and those would be the people that will advise you as to the next steps.
Great. Okay.
It's important for people to understand that.
Okay, so we'll move to open session. for topics not reasonably anticipated 48 hours in advance of this meeting.
You know
So,
what?
yeah, go ahead.
I have a quick one that, I just want to make sure that our town departments here have got necessary tools in place to sanitize. So I was thinking, if somebody does make an appointment and comes in, puts their arms on the counter, puts their hands, puts their papers on the counter, when that person leaves, we should have sanitizing wipes so that that person can then wipe down that table, wipe down that surface.
Right.
So that the next person that comes in.
Right.
And I'm not sure that every department here has sanitizing wipes, can of Lysol or something, and masks. But I think before, in case this levels do rise, we do get some confirmed cases, in case that happens, and, this escalates, that town departments are equipped with necessary equipment to battle that and
Right.
to be prepared to, sanitize their own workspace. So I don't know if we can, Kristen, if we can just make sure that every department has something like that in place under the counters,
Yeah.
somewhere where they're able to take care of their space. And still
Absolutely, and,
healthy.
I listed food establishment plans, and I know that our inspector, we had discussed, well, you guys had really discussed it before. Excuse me. How do we, I guess, what are we looking at with that, as far as the restaurants, the food places? Emily? We're looking
No,
at
I
you?
mean,
Oh,
like, we should look at her too. You shouldn't probably
Yeah.
go in.
Yeah, that's what I was gonna bring up too. So restaurants are supposed to be closed. It's only takeout only. So
Who is that? I'm sorry.
restaurants,
Oh, restaurant, all restaurants.
all restaurants
Okay.
are only takeout only. So I feel like there's not a huge issue with that. And I think Ray, who's the food inspector, I think he's done a lot of inspections
done a lot of
lately.
them,
So I think that people probably are up to date with everything going on there, and I'm sure he's on top of that.
Right, right.
But I was gonna say for myself too, so right now I have 3 complaints I'm dealing with that I can definitely just see from the street, but other ones, I do need to go into people's houses. Should we say for now, no, or should we say case by case?
No, I wouldn't say no, because it could be a health situation,
Right,
and we have to address it, yeah.
Maybe we need to get PPE for you.
yeah,
Yeah, we have to get personal protection for you.
yeah.
So maybe
sure.
We can
Like
get some masks for you, some
Gowns,
gloves, tie-up
masks,
gown or something.
because this is, this is serious stuff, so,
And what about other departments that do have to go into people's homes who might not be an urgent need? Should we discuss that too, or is that
Well,
something those
building's
departments-
only going to do,
Right.
the building inspector's only going to do new construction inspections inside and any outdoor inspections
Okay.
on existing homes.
So they've
He's not
already
gonna
made that
do-
decision?
Yeah.
Okay.
He's not going to do inside inspections on
Yeah.
existing homes.
I mean, I would recommend that that people in general limit the amount of business they do.
Right,
The amount of face-to-face contacts that they practice social distancing, and to do that, you have to do a little less business. But there's no doubt that this is going to hurt a little bit if this lasts for a couple months. But people, I think it's important that they recognize that the safety
yeah.
of others is pretty important. And it's not even necessarily, I mean, I know if you look at the numbers, and anybody can Google the statistics on it, but if you're over 80, this is a potentially very dangerous situation.
Right.
If you're over 70, it's a little less dangerous, but it's still pretty dangerous.
Right.
Even over 60, it's still pretty dangerous.
Right.
So granted, like kids, and if you're in your 20s and 30s, you might be okay. And maybe you guys those people are the ones out doing the work in their 30s, and that's fine, but it's not necessarily about them. It's about,
we might also just be the carriers and,
right.
That's right.
Just the
People.
carrier.
Showing no symptoms.
right. So what about maybe also just having gloves readily available in the town hall, so that way workers who are going out into the community can have access to them?
We have gloves.
Yeah, have
For
gloves.
town
Yep.
employees, for.
Right, right,
You should have,
right. But even like
Gloves.
Mark or other people,
Yeah.
like Kristen, if you don't want to touch all the money, that you're getting, or checks or whatever, you know what I mean?
Yeah, for now, I think we should all have.
Yep.
I think every town department should have some protection equipment, for sure.
now, I was going to ask you if you had your report, your agent report. That was my next question. But
What do you mean?
Well, you
Update, like an update.
have an update every meeting.
Yeah, so right now I have like actually a lot going on. I have 3, just with outside trash issues. So those ones I can at least just look at from my car and make sure. And then I have one that's also outside, but I'll have to kind of meet with the person. It's an outdoor wood burner, and it's causing
Oh, yes,
somebody some
okay.
health issues that I'm gonna have to look into what I can do.
We have regulations on that, Kristen?
We
Yes,
do,
we
yeah.
do.
And there's
That's what
a
I
woman at the
thought.
state level that's really good contact for that. Kim, I think her name is.
Oh, yeah.
Yeah, it should be in a folder because we had that
Yeah.
same issue a few years back.
Okay.
And if you access the folder, there should be a name inside the folder. I thought her name was Kim.
Okay.
She was a great resource for outdoor burners and the rules, and she was actually familiar with this case. Because this case, if it's the same one, I had the same case pop up.
Yeah, it is.
From when Joe used to be the agent, popped up again while I was agent, now it's popping up again.
Yeah.
It might be in that folder, I don't know.
And it was the same issue, so that number, she was a great contact for that.
Okay.
And I mean, I suggested the guy upgrade. At the time, when it was an issue with me, there was a pretty substantial grant for him to upgrade with if he chose to, and kind of that's what I thought he was doing. Because it
think he
became a
did, no.
non-issue, but obviously, he never followed through with it, and now it's an issue again.
Yep.
But yeah, she was a great resource, but I think it was a really old system. I mean, it was one of the originals, and the stack wasn't really up to code, I don't think.
No.
So it was, but like I said, she would be a great resource for that.
Okay. And then I have a reinspection of one on Linden Street, which is a heating issue. And then the last one,
What exactly is that heating issue? Does she have heat? Do they have heat?
so they have a pellet stove on the first floor, but nothing on the second floor, which is that loft.
I see.
Right.
Are they renters or owners?
Renters.
They're renters.
Yeah. So the pellet stove just isn't efficient enough for that
No.
second floor at all.
No,
So-
that's, I think, yeah, you had mentioned this in the last meeting.
Right, yep.
Yeah,
So that isn't resolved yet. And then the last one is something that the fire chief discovered over the weekend, and I just need to see what I am setting for, and then that letter will go out as well.
Okay.
And that's it.
Have they made any progress on the heat,
No,
the other homeowners?
no.
Maybe they should be sent a notice.
Oh, they have been.
They have? No, we should do something about that. That's not, that,
How big is the loft on the second floor? I'm surprised that
It's
the
pretty
pellet stove
big.
right below it doesn't take care of it.
would you be willing to go down? I'll go down too. And we'll talk and we'll take a look at it. Maybe I can contact the owner.
Yeah, if you want to, I think I'm going next weekend. We had already scheduled it for, so
Right? All right. So we can,
we can go next weekend.
okay, that would be fine.
Okay.
That would be fine. That's this coming weekend?
No, the
Oh,
28th.
the following
Yep.
weekend? Okay, that's fine. And you've already contacted them to let them know?
Yeah, we made this appointment last when I was there, so.
Okay, okay. All right, and that's pretty much it, huh?
Yep.
Okay. Anybody else have
Yes.
anything?
There's another safety issue we've talked about, and that's mowing the grass at the transfer station.
Yeah, uh-huh.
I think we should put that out to bid so that our employees are not subjected to the risk. And
Yeah, I'm concerned about them mowing that area too.
yeah,
I really believe that in the long term, we're going to put a retaining wall there. I really believe that, because I was taking a look at it just yesterday, and it would be attractive as well as serving the purpose, the way the purpose should be served. And that's my opinion, but, you know, maybe that's something that we can look at, like a 3-year plan down the road. You know, it probably won't happen this year or next year or the year after, but it's going to happen down the road.
I'm
It
really
has to.
surprised they didn't do it when they
I know,
did
I
the
know.
first step. I mean,
Right,
You know, that would have been the time while they're
Absolutely.
excavating, doing it all the work.
right,
I mean, you look at that hill and you think, boy, it looks like there should be a retaining wall.
yeah. The only other thing that I was thinking of is, you know how they have the large boulders, like
Yes.
in Millbury, going up to the shopping centers up there, and they have the large, that would be an option. But the only problem with that I can see, is that weeds would start to grow in between,
Right.
possibly.
Then you're pulling stuff out constantly.
Yeah, and anybody up there standing on that, I mean, you know, you can't.
Right,
So,
you could use a ladder.
Yeah, the best thing is a retaining wall, really.
So I think short-term,
Short term, yeah.
we should go out for bid,
Yeah.
see if somebody wants to mow the lawn for us. And I'm going to, with your permission, order the Dutch white clover.
Yeah, we're gonna
and
try
do
that.
an experimental section on that, which is the area George says is the most difficult to mow.
Okay.
And it's going to be something under $50.
Well, let's give it a shot,
Yeah, I think it's worth a try.
yeah.
Do you know if we have a hose up there?
They,
You have a faucet, I know that.
no, there's no hose, I don't think.
All right.
They have an outdoor
There's a-
spigot?
Huh?
They have an outdoor spigot on the shed, right?
Yeah, they have a
Yes.
hose bib out there, I mean, a silcock out there,
Okay.
yeah.
Yeah. All right.
So they're
So
all-
I'll take care of the hose part for
Yeah.
the short term.
No, well, we can, we can purchase a hose, I'm sure. Yeah,
All right.
Surprised they don't have one. I think that they might have to wash.
well,
them
we can
off.
check, we'll check, you know, to
They
make
should.
sure. I'm going up there tomorrow, and I'll check.
They may have a hose in the shed already, but.
So
Right.
you're
If they don't,
okay
they should
with the
definitely have it.
experimental section that George says is difficult?
oh, yes, that's
Dutch
fine,
white
yeah.
clover?
Yep.
Okay.
And if it works,
Do that.
it's good, it'll carry us through for a while, you know?
Yeah, that works, we can.
But ultimately, I really do believe that that area needs a retaining
Yeah, I
wall.
think long-term, we need to really look into
Then they
that.
can mow the lawn like they have to mow it, you know, not like this and like
Well, it'll
that.
free up, it may create more space down at the bottom. too.
Exactly.
And we've been talking about going out to
Exactly.
bid and adding packers for recycling, so.
Exactly, yeah, yeah, yeah,
We sort of need, we could maybe use some of that extra space.
Right.
Going forward in the next 5, 10 years, so.
absolutely.
Yeah, I think that's probably an important upgrade.
All right, so I'll work with Kristen on the bid letter.
But for now, yeah, let's get let's get those small plants installed and
Okay.
hopefully minimize the mowing that the guys have to do.
Okay, did have another question about, I jotted down, Hayward Landing tenant coming back from Europe.
I haven't heard.
Yeah, I don't think there's anything we can do. If they live there, they have to be able to
Yeah,
go home. There's, that's their house, so. it's
I
sort of
understand,
one of
yeah,
those
but,
things. They could self-quarantine and stay in their apartment,
yeah,
and maybe somebody else. I mean, maybe there's somebody at the front desk
how do we
there.
control that? That's my question, you know what I mean?
I think-
You can say, okay, you're in quarantine.
We can't. I don't think we can. I don't think we could make somebody stay there. But I think it would be highly recommended that that individual, if they've been on vacation, especially in a high-risk area, now a lot of places aren't high-risk, so, but I would think it would be highly advisable that somebody who has been on vacation at a high-risk area quarantine themselves. Like Anishka mentioned, she had somebody doing that on their own. If they could do that on their own, I'm sure that if they reached out,
That would be the
there
best,
would be people that could deliver food for them. I'm sure there's people out there that could do that, if they could minimize contact with
yeah,
people
yeah.
and follow the guidelines, I think.
Agnieszka, what would your take on somebody who's returning to an
Well,
apartment
do we know where they're
complex?
coming from?
I don't know what country exactly. She does.
Somebody's returning to an apartment complex to Hayward Landing who has traveled abroad, Europe or recently. Obviously, we can't deny them access to their home. Any recommendations for that person?
Since the person has no symptoms, he cannot be forced to quarantine. Education is the best tool. So tomorrow morning, first thing in the morning, I'm going to call this resident. I have his phone number. He's coming late tonight. So first thing in the morning, I'll contact him and I explain the importance of self-quarantine.
Excellent.
But we did consult the lawyer, and current laws don't allow us to force him into quarantine
Right.
because he has no symptoms. The recommendation is stay home in the apartment, don't use the common areas, don't use the laundry room. We recommended the management to stock up his fridge, offer some help, because he was away for, I understand, a couple of months. So make sure he has all essentials before he arrives, so he has no excuse to leave the apartment.
Right, so the management, I mean, should really be taking control of that situation.
So I did, I emailed the manager of the buildings and with the recommendations, and like I said, tomorrow morning I'll do my best to talk to the person and educate him on the importance of self-quarantine. But like I said, he has no symptoms. As far as I know, he's not showing any symptoms of the infection. So
Excellent.
yeah, we have to hope he will understand and he will follow the guidance.
Yep.
Okay.
One item.
Yep.
Corey mentioned delivery of food. The senior center, also known as the Adult Social Center, is working with the town on developing a list of people who will do those things. Volunteers who will go do the shopping, deliver it outside to the front door, walk away.
Yep. Yeah, that's
So
good.
there's people out there doing that type of stuff and
Right.
helping. So the
They're working.
resources are out there. And, you know, there's certainly people in the town hall here that could probably put somebody in contact with the right people. So I think within a couple of phone calls, you could probably have things in pretty good, or have yourself in a pretty good situation.
I just want to bring something up. In my opinion, and this is, again, only my opinion, I just feel that we're missing the tools to address certain situations that you're inspecting. And we have to find out exactly what we can do as a Board of Health to make sure that people do take what you say serious. So when you go out there and, you know, you see these situations, you've got to have something behind you, you know, otherwise they're just going to, yeah, okay. And that's what it kind of seems like is happening.
Yeah.
It seems like you go on these inspections, you go out there and you see these things and you have no weapons to use. It's like, this is, you know, there should be some kind of a 48-hour kind of thing, cease and desist or whatever.
Yeah.
Fines, but we have to start doing that, not just talking about it.
I think we'll have to implement all those things though into our current laws and regulations that we have.
Yeah, I think.
Yeah.
I'm pretty sure at town meeting a few years ago, the old building inspector did that exact thing and got passed an ability for him to fine people up to $300 per day.
That was for the building?
That was the building
Yeah,
department was
yeah.
able to do that, and that was the previous building inspector did that at town meeting.
Yeah.
So I'd imagine that the agent would have to do a similar thing.
Yeah.
And I'm not sure, but I think Board of Selectmen or Matt would be the person to approach with those types of questions.
I did do that, and he was supposed to contact our council.
Council, so town
Yeah,
council. would
town
be-
council, so.
And then that, because
The
I
point-
agree.
Yeah, the point is, you've got to go out there, you've got to deal with these situations, and you've got to have something behind you. So,
You know, when I was agent, I felt the same way. It was,
Yeah.
you know, a lot of people were really good and
right,
did what they were supposed to do.
Right.
Because, I mean, a lot of things are kind of silly and should just
Sure.
not be happening.
Sure.
And a lot of people understood that and did them. But
Sure.
you're right, you get those handful of people. I mean, look at, that Arch Street, you know, that thing
oh,
was.
that was a nightmare,
So
yeah,
there's certain places that are just hard.
yeah.
Hard, and
yeah.
people just don't adhere to the rules. And it'd be nice to have something to fall back on
Yeah.
if that happens to you.
So, we're looking into it anyway, okay? So do we have anything else? Any old business, new business?
Next meeting date?
Next meeting date is?
Tomorrow,
good?
scheduled right now.
Is it? Yeah, tomorrow, you're right.
Which we'll probably cancel.
Yeah,
Yeah.
we probably canceled down. As of right now, we don't have a lot of agenda items, but I think we've scheduled a meeting date for the Board of Health for every day of the week. Moving forward, as we'll cancel the meetings if we don't have agenda items to talk about, but with the current situation, we thought it was pretty important that we do that. Oh, did we have to talk about the child care centers?
Oh, yes.
The new regulations
Yes.
based on those?
Yep, good idea.
So I guess Governor Baker stepped in and,
Well, let me read this. I'll read this and then,
That was before the final decision. Oh, did you get the new decision? Was that from Jean? I didn't, yeah.
this is from Jane.
Okay.
She said this just came out. Okay, it's Dear Parents and Guardians. We were just notified that Governor Baker has ordered all early childhood educational programs across the state of Massachusetts to suspend providing childcare by Monday. So that's this Monday. That would be, what's the date on that? That would be, today's the 18th?
7/23.
23? Is that right?
Yep.
Okay. So it would be next Monday, the 23rd of March. And at the same time, the Department of Early Education and Care, EEC, is establishing a process to approve exempt emergency child care programs to serve vulnerable children and the children of families who are required to work to maintain the health and safety and welfare of all Commonwealth citizens. This approach prioritizes public health and safety while maintaining a critical service for vulnerable children and children of families who are required to work during this panic. Exempt emergency child care programs will be the only child care programs that are allowed to operate during the COVID-19 state of emergency. So our Blackstone Valley Children's Place, BVCP, preschool and school-age programs in Whitensville and our Rockdale Youth Program, Rockdale Youth Center, programs will close for 2 weeks beginning Monday, March 23rd. Please remain safe and healthy as a family. We look forward to seeing all of you soon. And that's pretty much it. And we can probably get copies of this. So,
in a nutshell, you have to get approval through the state to run a daycare at this point.
Right.
As of
Right.
Monday.
Right.
And the only way you're going to get approval to run a daycare is if you're taking care of nurses, children's, first responders.
Right.
Essential employees,
Right.
really.
Right.
If they have children, they need a place that
Exactly.
somebody can take care of their kids while they're out doing this work.
that's it.
But if you're just
If you're just a daycare center and,
you're a plumber, then
Yeah.
you don't have a spot to bring your kid right
No,
now.
no,
And that's just the reality of the situation.
it is, yeah.
So I think we had that question come up in the office a few days ago.
Yeah.
And I think that answers it.
Right.
So unless you're an essential employee, yeah, you have to stay home, I guess, or find alternate.
Find
daycare for
another
your-
way,
for your
right,
kid.
right.
Daycares
Right.
are shutting down.
I'm sure that the towns, the state, the federal governments want people to stay home anyway, so that we can end this thing as soon as
Right.
possible.
Right.
So, okay, is there anything else?
Boy.
Okay, do we have a motion to adjourn?
So moved.
Okay, the meeting is adjourned.
All right.